Welcome everyone, and thank you for joining us. My name is Teresa Rump and I'm part of the MediTab sales team. Today we will be discussing IMS Televisit, and later on we'll take a tour of this feature, everything from appointment scheduling through super bill creation. I'll be joined by Mike Silberman of our MediTab implementation team, and he's going to take the lead on the live demonstration. Let's take a look at today's agenda. So today we're going to take a look at the reason behind the urgency for this presentation, the unprecedented circumstances we find ourselves in. We're also going to share with you the way MediTab wants to help all of our clients and our clients' patients. Televisit, designed for every practice. This is about the IMS Televisit, and we want to show you how, no matter how you're using IMS EHR, we have a televisit solution for you. And we have a special offer, and that speaks towards MediTab wanting to help during this time. I'm also going to share with you some support publications and tools that are available. We'll have an actual live demo where you'll be able to visualize all of the workflows for televisit. And we'll also briefly discuss some other help that we have available for you should you need it. Okay, first off, unprecedented circumstances. So COVID-19, coronavirus, SARS, CoV-2, bug by any other name, highly contagious. It's causing anxiety nationwide. The CDC is projecting 100,000 possible U.S. deaths from the pandemic. It's spread primarily through droplets from a sneeze or cough, but it also appears that it can last for either hours or days on surfaces. So this is causing nationwide anxiety, and the majority of states already have stay-at-home except for essential services orders in place. Medical care is without a doubt an essential service, but it's also a risk for transmission. So our clients are looking for a way to filter for symptomatic patients, how to keep them out of your physical office, but still provide them with the vital care that they need. Also, there's worries about asymptomatic patients, anxious patients, and worried staff as well. And MediTab wants to help. So IMS Televisit is the perfect complement to your IMS EHR during these times. Video conferencing protects your families, your staff, and your patients. Technology is going to allow for you to continue to deliver vital care to your patients during this time, and it will bridge the isolation and loneliness gap, especially for elderly patients. Elderly patients and those who are very anxious, they may actually be staying away from their necessary medical care because of fears of contagion. It facilitates shelter in place and safer at home government orders. Now CMS and most other payers, they have eliminated the barriers for getting paid for telehealth services. Used to be that you could only provide these services for very narrow reasons and very narrow settings, but that has been completely eliminated. And now, like I said, most payers and definitely CMS are reimbursing for those. And the bottom line is the bottom line. I talk to clients every day. Many of them are worried about having to lay off trusted staff that have been with them for a very long time. Many of them are worried about keeping their doors open. So revenue from televisit, from telehealth, is much needed at this time. It can be a bridge over this the time of the pandemic, and good for everybody. Televisit's designed for every practice, so no matter how you're using IMS EHR, we can put televisit into your office. Now I'm going to take a little side trip down a side road here just briefly, I say IMS EHR. IMS, of course, stands for Intelligent Medical Software. If we activate allergy functionality or fertility functionality or cosmetic functionality, you may know IMS EHR by a different name: Allergy EHR, Fertility EHR, Cosmetic Suite. So when I say IMS EHR, I mean all of the EHRs that we have. No matter what their name is, the core is still IMS. So if you are locally installed, that means your server, which houses your IMS, is in your physical office. You can get out of your desk chair, walk over there, and kind of pat it on the head. That's called a local installation, and you have the most options when it comes to telehealth. So you can use IMS EHR as the trigger for opening up the video conferencing platform, and your patients can join using either Care Portal or the patient app. Or you can choose to do IMS Go Provider app for teleconferencing. Your patients can use the Care Portal or the patient app, and you can have your IMS EHR open concurrently and do your clinical documentation right there. That's very popular. Now, if you are in a remote or hosted installation, that means you can't touch your server. It is either at your IT company's, or it's in a location, another location, a remote location at your home, or it's in the cloud, because the cloud services are being offered by Meditab MG Hosting. Then you can still have telehealth services. It's just that you'll need IMS Go for the to trigger the video conferencing platform, and your patients can use Care Portal or IMS Patient app. Now, the prerequisites. You do need to be on your IMS EHR build 21.1.0. Take a look at the bottom right-hand corner of your IMS, and the number for your build is right there. If it says build 20 or something earlier, please reach out to your account manager and we will put you on a list to have you updated overnight. Build 21 has a general release, and we're urging everyone to get on it as soon as possible. We're doing 30-40 updates a night, so we can get you fairly quickly. And you'll also need to update the build on your Care Portal, your patient app, and your provider app, IMS Go. Optional but recommended, IMS Care Portal. Now, if you don't have Care Portal, that's okay. We can have your patients join the video conferencing using the IMS patient app. You do not have to have Care Portal installed. However, we're recommending it because your patients can fill out their forms on the Care Portal. Very handy. And once they fill it out, that information, of course, is pulled into their record. This is taking you a step away from paper. Now, IMS Integrated Credit Card Payment Processing Service through OpenEdge, we are highly recommending this. This will allow you to accept payments, integrated payments, for your televisit, either the copay or for the visit itself if you're not billing the insurance. This is going to shorten your billing cycle and increase the profitability of the service. And I know you're saying, well, I've had my merchant card service for years. You know, I've been with them a long time. I've gotten the rate down, a really great rate. I don't want to give that up. Well, Meditab negotiated a great contract with OpenEdge. They are obligated to offer all of our clients a meet or beat price guarantee. That means you can't actually lose money by moving to OpenEdge. And with the integrated payment service, that means that your patients can pay you directly from the patient app, from the Care Portal, and for IMS On Arrival, the self-check-in app, which we really won't talk about today, but it is there. So again, optional but recommended. Okay, televisit designed for every practice. Here's the top reasons to implement this right away. We have, of course, we have the two-way video conferencing. We have the integrated payment options if you sign up with OpenEdge. It complements your IMS EHR. Care Portal recommended but not required. patients can self-register for the IMS patient app. I used to hear some complaints that the registration process was onerous. However, it's the simplest thing in the world now. Patients can self-register on the patient app. They don't have to go to the, the care portal. You don't even have to have a care portal in place, and your staff doesn't need to get involved. Televisits are easily scheduled. They're as easily scheduled as any appointment in IMS, and we'll go ahead and show that during the demo. You can still use IMS In Touch for appointment confirmations. You can even send the meeting link by email to your patients, and that will also streamline joining the televisit process. Patients can join from email link or patient app or care portal. Providers can create super bills on IMS Go. So you see the patient, teleconference is ended, and now your providers can go ahead and create the super bills. This is going to shorten the billing cycle because everything's updated in real time. Your biller will have access to that super bill information as soon as it's created. And there will be other visit note options, which are Dr. Mike will take us through in a few minutes. Okay, special offer. Again, we want to help. Meditab wants to help. What we're offering all of our clients is 90 days or till June 30th, 2020 of free, unlimited televisit services. So no charge for the televisit services themselves until June 30th, 2020. The first bill you would receive would be July 1st. So there's $350 set up per practice, not per provider, per practice, which just covers our third-party fees. And then on July 1st, if you decide to continue with Televisit, it will be $40 per month per provider for unlimited televisit. If you've looked at this before and you notice that we were charging by the visit, we've completely eliminated that, and we have nothing but unlimited televisit pricing now. If you need to add an app in order to make this work, IMS Go or the patient app, it's $60 per month per provider. Unlimited televisit plus that app. If you need to do 2 apps, you have no apps installed at all, then it's $75 per month per provider for unlimited televisit plus IMS Go and the patient app. Again, free monthly service until June 30th, 2020. Cancel without penalty. I think this is very important. Televisit is not necessary in some specialties, not as useful. If you just need it for the duration of the pandemic, this is awesome. You can call us up and say, okay, everything's resolving. I don't need this anymore. Please cancel. So you can call anytime before June 30th, 2020 and cancel without penalty. There is a 12-month renewal term. And for more information, you can contact sales@meditab.com, our main phone number, or reach out to your account manager, your Meditab account manager, and they will be more than happy to get you the information that you need. Thank you. Okay, support publications and tools. Meditab has set up a COVID-19 resource hub. You can go to meditab.com and there's a banner across the top, and that's a link to it. It talks about the Televisit special offer, and it talks about the website appointment booking system. This is another exciting tool that may help you out during this during the pandemic. This allows you or your patients to make appointments on your website without having to call your office. So it's not like the patient app or the care portal where they request an appointment. This is actually making an appointment, and you determine what slots are available for what types of procedures, what providers and what locations. So it syncs with IMS, and patients can make appointments without calling the office. So maybe you're short-staffed or overwhelmed. This could be a way of relieving the burden on your front office. We do have the COVID-19 and person under investigation. Persons under investigation templates are ready for the IMS EHR. Go to the Resources Hub and you can sign up and get more information about that as well. That's available to all of our clients. It's persons under interest. I'm sorry about that. Televisit and coronavirus CPT ICD. We are updating all of our clients with those codes. Patient resources. These are printouts that you can upload to your patient user library, or you can print them out and hand them to the patients. And it's in regards to hand washing techniques, self-isolation, and quarantine. Coronavirus education resources are also available. This includes links to World Health Organization, Center for Disease Control, and Health and Human Services, their coronavirus.gov link. Staff remote working tools. So a lot of you have staff that are working from home. You may be working from home yourself. And so we have information on tools that we have that may facilitate this. IMS Go, of course, the provider app, not just for teleconferencing. You have your entire office on your smartphone or your device, all of your patient charts, their prescriptions. You can OK refills, you can write new prescriptions, you have access to their entire history, lab results, order labs, any messages or faxes or documents that have come in are available to you as well, your scheduler, super bills, all of that available on IMS Go. It's basically your practice in your pocket. Cloud hosting. So if you currently have a locally installed IMS on your server, if everyone's working from home, you still have that physical server in your office and someone needs to take care of it. And you may be encountering a lot of expense or trouble or worry about security trying to set up a network so your employees can remote in. MG Hosting, a sister company of Meditab, can take that worry from you. We won't charge you anything for the migration. We won't charge you anything for the hosting for 60 days. And it will be very easy for your employees to work from home. Okay, offsite backup. Unfortunately, there's been an uptick in cyber attacks during the pandemic. It was already pretty bad prior to that. If you have an offsite backup in the cloud, protected, and the worst comes to worst and your server is attacked, at least you can restore your data from last night's backup and start seeing your patients again. So we highly recommend our offsite backup if you don't have that in place already and you are self-hosted. And also the remote payments with OpenEdge, allowing you to collect payments from your patients without them having to come into the office. You can share statements on the care portal and the patient app, and you can collect payments as well. Great service. Request more information at sales@meditab.com, our main number, or again, reach out to your Meditab account manager. Okay, next we have the live demo of Televisit. Easy as 1, 2, 3. First thing I'm going to do is I am going to share my smartphone with you. So please bear with me for a moment. Okay. One moment. Share. Start broadcast. Okay, there you see my screen. Now I am going to go to my patient app. And we are going to enter my name. I'm Victor Vasquez for today. All right, I'm going to enter my password. Almost there. Done. Log in. And there we go. It's as simple as that. So here we have the patient app. If you haven't seen it before, normally there'd be an image of myself there. The patients have access to their appointments, appointment history. They can request appointments. They can see what appointments they have coming up. Any documents the practice shares can be uploaded. Prescriptions, I can go there. I can see what I'm supposed to be taking, when I'm supposed to be taking it, how many, and also request refills. On the billing side, I can pay my copays. I can pay my balance. We have secure two-way messaging, HIPAA compliant, between the practice and the patient here. And we also have the barcode, which facilitates instant check-in utilizing the IMS on Arrival app. You just need to wave your barcode in front of the webcam, and it starts the self-check-in process. This is very, very popular with our allergy offices when our shop patients can come in and check themselves in. Okay, so I am going to request an appointment. I've not been feeling well. I'm going to hit the plus calendar icon at the lower right hand. I normally go to office 55 and I normally see Dr. Silberman, so that's fine. Yes, I am requesting a televisit. Reason for visit. So not been feeling well. Fever for 3 days. Okay, worrisome symptom nowadays. Preferred date and time. So I can put in my preferred date and time here. And I'm just going to choose. Okay, okay. Contact details, my email and my phone defaults here. And now I'm going to submit. Success. Okay. There we go. So you see it goes under requested. You see that I have requested a televisit with Dr. Silberman. And so now, Dr. Mike, are you there?
I'm here, Teresa.
All right. I'm going to, do you want me to pass the presentation rights to you and you'll show everyone in the scheduler?
Yes, of course. If you can, make my computer the presenter.
Okay, will do. There you go.
Thank you. So thank you, Teresa. As a provider, I want to be able to help my patients during this tough time. And I want to be able to help them without exposing myself to the coronavirus. So my solution is the televisit, which offers me the ability to help my patients remotely. So now, as you just saw, one of my patients requested a televisit appointment. This is going to give me the opportunity to show you guys how this process works from beginning to end. So the first thing I want to do is I'm in my IMS and I want to import that requested appointment. So I can either go to this P in the top right-hand corner, it's yellow, or I can go into my utilities, come down to IMS Care Portal, and select import. Once I'm in the import screen, I'm going to want to go to the appointments tab right here. I'll be able to see the appointment request from that patient. You can see it's the second one down, and I can even see the reason, fever for 3 days. So in order to schedule this appointment, I'm simply going to click the calendar icon. The system is automatically going to bring me out to the scheduler. So let's go ahead and schedule this appointment for a time close to now so that we can complete the call. So it looks like today is the 3rd still, and it's 11:23 p.m. So let's schedule an appointment for 11:30. Come down to 11:30. I'm going to double click on the 11:30 slot. And as you can see, the system makes it very simple. it automatically fills in that patient's information. It even automatically lets the system know it's a televisit. So all I have to do now is select my procedure, and I'm going to go ahead and select my televisit procedure and hit OK. You would schedule just the same way as you normally enter patient's information. Let's hit OK. And now you can see the televisit icon appears, indicating that this is a televisit appointment. Now that that's scheduled, I want to switch gears and show you how this looks from IMS Go. And that's the app the provider is going to be using as their primary source where they're going to connect the televisit appointments to the patient. So if you will, Teresa, can you make my phone the presenter? Thank you so much. Let me go ahead and broadcast from my phone. Okay. Let's see. Give me a second. Give me a second to reconnect. If you can, Teresa, will you go ahead and make my phone the presenter again?
I sure will.
All right. So let's try that one more time. Let's start my broadcasting. Perfect. You're able to see my screen. I'm
Confirm.
going to enter. Perfect. So I'm going to click here on IMS Go. I'm going to highlight that first so you can see what it looks like. You can download that from the App Store, either Google Play or the Apple Store. I enter my username and password just like I would to log on to IMS. Click on there. Now, once I'm directed to the home screen, I have a few different options. The first topic I want to discuss is the scheduler. So I'm going to highlight that button for you to see and then click it. Now we're going to be able to see the appointment that we imported in IMS. So you can see all the app and IMS are connected. See that appointment right there at the bottom? And it indicates that it's a televisit appointment with the camera to the left. Now, I could also schedule an appointment straight from the app. And if I wanted to do that, I would simply click on an availability slot. And the app is going to request some information. I would fill it out just as I normally do. I would select the type of office visit. I would select the patient's name. I can search the time, the duration. I could select the procedure here, so I could go down and select my televisit procedure. And then finally, and most importantly, if we're doing a televisit and we're scheduling this appointment as a televisit, we're going to want to make sure to select the toggle button at the bottom. See how it just turned highlighted green? We're going to make sure that that's set to yes in order for the app to recognize that this is the televisit appointment. So once we finish entering all of our information, we can hit save. In this case, we already have an appointment scheduled, so I'm going to hit no. The way we connect to this televisit appointment is we're going to do that from the check-in, check-out screen. So that button is very large in this home screen. I'm going to highlight it before I click it. You can see it right there. And it's going to bring me to the check-in, check-out screen. In the upper right-hand corner, you'll notice a schedule icon. I'm going to click that. That's going to show me all the appointments I have today. Now, the ones with the camera, in the black little camera icon, are going to indicate to me as the provider that this is a televisit appointment. First, before I click the camera, I want to show you the little note icon. This is that note that our patient left for me when they requested the appointment. So as you can see, it says fever for 3 days. So before connecting me as the provider, I can go in and look at that note and just have understanding of what this visit's going to include. I'm gonna hit OK. And then I'm going to click the black camera icon to start the visit. In just a moment, you'll be able to see me pop up on the screen.
All right, so now we're going to show the patient app. 1 second while we make that switch.
Good. Waiting. Let me show you how it connects from the patient side.
Okay. Oh. Hold on 1 second. Make presenter. There we go. And we will start the broadcast. All right, we're looking at my phone again. And we'll go over here to the patient app, and there we are, Victor Vasquez appointments. And it automatically pops open. It says future appointment with Dr. Silberman today. And you see the camera icon at the bottom, it's flashing, join, join, join. So I'm going to check on that. I'm going to give permission. And there you go. Hi, Dr. Silberman.
Hello, patient. It's good to see you.
It's good to see you too. This is wonderful that I don't have to come into your office because I'm so worried about getting people sick.
I understand. And it's great that I can see you over this televisit.
All right, now I'm going to pass the presentation back to your phone, Dr. Mike.
Thank you.
There you
I
go.
am going to share my screen with you guys. Okay. Let me go back into the patient or the provider's app just for a second. So as you can see, once the televisit is complete, the provider will have the responsibility of ending the call by clicking on the red hang up button at the bottom. So you can see that icon at the bottom. This icon is going to only be available to the provider. And that's because we want the provider to have the control to start and stop the meeting. So as soon as the call ends, I'm going to go ahead and push the red icon at the bottom.
Bye.
There we go. Bye. And then I'll let the system know, yes, the televisit is over. And as soon as the call ends, the system will automatically move the patient into the checkout screen. So let's go ahead and take a look. I'm going to close out of my appointments. And at the bottom of the screen, you can see an arrow pointing down. This indicates that we're in the check-in screen. And then you can also see an arrow pointing up. That's how we get into the checkout screen. And as you can see, right next to the words checkout, we have one patient waiting for us. So let's go ahead and click. All right. So the patient that I just saw, Victor Vasquez, appears in the checkout screen. Now we're looking at the one on the bottom. That's the most recent visit. The way now we're going to have a few options in this checkout screen. The first thing I want to do is I want to hit the plus button. This is going to bring up some options. I can enter the super bill, or I can enter the visit note options. Let's start by showing you how it looks to enter the super bill from your app. So I'm going to go ahead and click on the super bill icon. I highlighted it and I'm going to click it. I'm going to use the same password I would use to sign off on my visit note. Submit. All right, let's try that again. Okay, so that is me absent-mindedly forgetting the password I used. Sorry about that. There we go. So it's going to ask me if I want to enter the visit note for this patient. I'm going to hit yes. It's going to say the visit note is successfully created. I can choose the patient's status right there. But first, what I want to do is I want to go in and I want to show you how it looks to enter the super bill. So let's click on the super bill icon. The first item in our screen is going to ask for the procedure code. So I want to go ahead and enter a procedure code for Televisit. I have one available here that I can show you. We'll go 99444. Once I click down to the next field, the system is automatically going to choose that visit, that procedure. Then I'll be able to enter my ICD-10 code. I'm going to select Browse, and the system is going to automatically bring up that patient's active ICDs. But I can also, look through inactive ones if there are any available. Let's go ahead and just choose the first one. All right, I'm going to check mark next to that. You can see the check mark appears on the right-hand side. Then I'll go back. I can also enter my point of service. So whatever point of service matches up with this type of visit, I can go ahead and select that here. I can enter my modifiers, and then as soon as I finish filling out this information, I'll hit save. IMS has successfully saved this super bill, and I'll show you how that looks from within IMS on our desktop. So let's hit OK. Now that we've entered our super bill, let's take a look at how our visit note enters. So you won't be able to fully document this encounter, but we can enter notes and do dictations and record those dictations and then import them into IMS so that when we're in our system, we can go ahead and fully document that encounter. Let's click on the visit note options. We're going to do today's visit. And as you can see, we can see our categories for our templates that correspond to what we see in IMS. Let's start with our chief complaint. As you can see right next to the words chief complaint, there is a record icon. This is going to allow us to dictate and record our notes. I'm going to go ahead and click it. Once I'm ready to start recording, I'll hit the play button. And the system is going to detect the inflection of my voice and show you with that line passing through the screen. Once you're finished, you can pause or you can just stop. Once you stop the recording, my screen froze. My GoToMeeting froze, so let me go ahead and restart that. I'm just gonna share my screen again. Sorry about that. When you use GoToMeeting to show, sometimes it freezes from the GoToMeeting platform. So there you go. So once we stop that recording, you'll see 3 new options at the bottom. We can delete, we can record a new one, or we can upload. You can also upload from a different screen. So I'm going to hold off on doing that just for a second. I'm going to back out of this screen. And now you can see the recording icon has switched to a cloud with the word upload. That's where we can upload this recording also. So let me go ahead and select that. There you go. So the audio recording has been uploaded to IMS. The next icon we can see is the note icon. Before we go into the note icon, also take note that there is a play button, so you can go back and listen to your recording if you'd like. Now, let's click on the note icon. From this screen, I'll be able to enter notes. So let's go ahead and enter one in. Let's say we saw this patient and we'll enter test chief complaint. And I'm going to show you how this appears in IMS from our desktop. Once we've finished entering our note, we'll hit save. We can then proceed to fill out the rest of the visit note, visiting each of our categories on the left-hand side, recording or entering notes about each of them. And then finally at the bottom, you can see we can enter the super bill. All right, so let's go ahead and take a look at how all this looks from IMS. So Teresa, if you will, make my phone or my computer the presenter. Thank you very much. All right, so I'm going to open IMS. And I'm going to start by showing you what it looks like from the check-in, check-out screen. So let me close my scheduler, close my import screen, click on my check-in, check-out icon. Now, initially, when you schedule the televisit appointment, it's going to appear in this left-hand column. And you'll even be able to see the televisit icon. As soon as you connect to the patient, remember I told you the system automatically checks that patient in and moves it into the center panel. And as soon as you end that call, the system will automatically move them into the checkout on the app. So let's take a look at the visit note we just entered. So let's find that patient. We scheduled the appointment for 11:30, so we can see it here. I'm going to go ahead and double click on it. Say yes, I want to enter the visit note. And as you can see in the left-hand column, let's start here. Remember, the subject we covered was our chief complaint. You can see the recording symbol is different for those items which we haven't recorded anything for, but the one we did record, there it is. So you'll be able to access your recording. You can record a new one, you can record, append, or you can play. Now, remember that note we entered? Well, here it is. So we can use that information to, fully and thoroughly go through and use our point and click options to document this encounter. So reminded of what I did, I'll simply click on Chief Complaint and go through my normal point and click options as I usually do. It's that simple. Let's click out of there. Now finally, remember we had entered items in our super bill? Well, there's our diagnosis. Our ICD-10 code is showing up right here in the visit note. We can also see our completed super bill here. So I'm going to go over to the right-hand side and click on super bill. And you'll be able to see the procedure codes that we selected, the procedure codes that we selected up here, right here at the bottom. And that's our Televisit CPT code. So I can save and close. So that basically gives us the overall process on how Televisit works. And you're able to see that we're able to document from within the app. And then that information reflects almost immediately. In fact, it does reflect immediately in the visit note in IMS. So you can see how it's all connected. Now I'm going to turn the meeting back over to Teresa, and she's going to close us off.
Thank you, Dr. Mike. Thank you very much for that tour. And it is as easy as 1, 2, 3, very easy, very intuitive, and yet very powerful and integrates with your current IMS. So thank you very much for that. All right, so thank you very much for staying with us this long. We're going to go ahead and wrap up. I just wanted to briefly touch on one other item because we're talking to our clients during the pandemic. We're hearing that they're facing staff shortages or employees that are staying home. They can't really work remotely, and or they're having a big increase in volume. They have a lot to be done. So if you don't know, Dr. Catalyst is a Meditab company, a sister company, part of the Meditab group. And they offer complementary services that could help you during this time. Temporary staff shortage, need a little extra help, want to take your practice to the next level when crisis resolves. And that's another thing. I know a lot of you are at home, volume's down, so you have time to think about, what do I want to do with my practice in the coming year or the next 3 years? Where do I want to be? So we could help. We can provide admin and clinical assistance. Now that is everything from data entry to insurance pre-authorizations, document management, fax management. We offer full billing services as well, full RCM. Medical practice marketing, so your numbers may be down and you want to get your practice name in front of people again as soon as the pandemic resolves. You want to attract new patients. You need to rebuild your patient base. So we can help with that with medical practice marketing. Appointment booking through the website, we touched on that briefly before. Your patients can make their own appointments. It syncs with your IMS scheduler. And also concierge services. If you would like to provide a higher touch, more personal service to your patients, we can help with that as well. For more information, please reach out to info@drcatalyst.com. You can call their main number, or your Meditab account manager can put you in touch with them. So that concludes our presentation. Thank you very much. We at Meditab want to thank you all for your service. You're on the front lines. We do so appreciate it. We want to be here to help. So stay healthy, keep safe, and we'll be talking to you later. Thank you.